Good evening and welcome once again. Today is our 1486th day of continuous webinar. Thank you all the participants for joining with us. Thank you all the faculties for sharing your knowledge here. Thank you so much. And many back-end supports are here from the homeopathic lovers and all. I am thanking all of them for your struggle and pain behind this. Thank you so much. Now, today's our guest is Dr. RAJAT CHATTOPADHYAY. He's he's MD in homeopathy, PhD in homeopathy, and he's a principal of Calcutta Homeopathic Medical College. 27 years of experience he has, and he's author and he presented papers nationally and internationally. He is the author of 3 books and resource person of NCH, CCH, CCRH, NIH, and presented office in charge of Bengal Health University for 5 years, and worked as a HOD for 12 years, chairman of drug proving committee of CCRH, and many have to say about Dr. RAJAT CHATTOPADHYAY. And now it is the time, we already 3 minutes late. I am welcoming Dr. RAJAT CHATTOPADHYAY for IFPH. On behalf of IFPH, sir, you're welcome. Please. We are so glad to get you as a speaker today. You can.
So?
Yes, you can share, sir. You can share.
Yeah.
Yeah.
Okay.
Yeah.
So the topic is dermatology and homeopathy. Dermatology is a specialized branch of medicine that focus on diagnosing, treatment, and preventing disorders related to the skin, hair, nails, and mucous membrane. Actually, the scope of dermatology is vast. It is covering everything from acne, eczema, rashes, to more severe complex diseases, even like skin cancer. So I will like to go very fast because few things are well known to all of you, like very common thing like eczema. Atopic dermatitis is one of the type. It is not that all eczema will be called as atopic dermatitis, but most of the presentation of atopic dermatitis usually with an eczema, and it is a chronic disorders often marked by red itchy patches of skin, and it is common in children but may persist into adulthood. It is to be noted that atopic dermatitis usually it may disappear within the age of 6 or 7. It may appear after 3 years, or after 2 years, 3 years, or 4 years, or it may disappear of life in most of the children. May or may not be, but it may disappear. And psoriasis, inveterate type of skin diseases, and it is the most obstinate one. So which leads to thick scaly patches, inflamed skin, typically seen on areas, especially it is the extensor surface. We know psoriasis, and whenever this same psoriasis can be seen in flexor surface, which is the reverse psoriasis. So we are very cautious about the psoriatic conditions. So right now you can see this is the typical psoriasis, the silvery scaly patches, the round, and previous one you can see the reddish one, that is one, and the typical psoriasis type. So right now we can see from acne. Acne is the most prevalent dermatological conditions. It is related to hair follicles become clogged with oil and dead skin cells, resulting in pimples, blackheads, inflamed pustules, and ultimately due to scratching, due to itching, it has a permanent scarring of if it is untreated. And vitiligo is a condition. Vitiligo is a condition that leads to the loss of skin pigment in patches due to the destruction of melanocytes. These white patches can appear anywhere on the body. The most important right now, it is the fungal infections, because that is the rainy season will be within 6-7 days or 1 to 2 weeks, it will be disappearing. But the fungal infection will remain, and it is the right time that fungal skin infections are in steady increase. So different types of, especially tinea. And we have to note that with all the advice, whatever advice we as a homeopath, as a clinician, we advise to the patient for the sanitations, for taking all the sanitary measures, but tinea infection is in rise. It is especially in temperate climates and Indian climates and in the damp areas, Marsi districts, all these areas, not only in damp areas, even it is in the more in the urban areas, the ringworms right now, it is in very much increasing. So particularly environmental factors are very much related to this. So you can see there is the differentiate if you go through the pictures. Right now, if you go through the pictures, you can see the typical vitiligo is there. You can see the tinea ringworm-like patches, and in the right side, very the fair lady, that is also the fungal infection. This is a fungal infection. The pityriasis versicolor manifestation is very common in this, even the blacks, even in the fairs. So rosacea is one of the chronic inflammatory skin condition for which you can see the swelling, which can it can cause the swelling, often the blood vessels, cheeks, at the cheeks, nose, forehead, and often it leads to acne-like bumps. Triggers include spicy food, especially right now. Today's is the spicy food, the junk food, the fast food. These are the causing obesity as well as this type of rosacea. Even the heat, even the stress, and if left untreated, rosacea can worsen over time. And another one, that is seborrheic dermatitis. It has got very good impact with the homeopath also, because we have to understand this seborrheic dermatitis. It is, we know that skin condition causes flaky, greasy scales. Greasy. You just concentrate on the word greasy, because this greasy is a psychotic predominant psychosis, having the greasy facies or greasy skin. So these greasy scales on the scalp, face, and other areas of the body is closely related to dandruff and can affect both infants, which is also called cradle cap, and adults. Its exact cause is not fully understood. It may involve a combination of yeast overgrowth, immune responses, and environmental factors. These are very important part. These are taken from the books of modern medicine. But whatever is written, that the combination of these, because we have seen in predominant tubercular, having the predominant tubercular diathesis or having history of tuberculosis or COX in the past history, family history, they are very prone to develop these type of seborrheic dermatitis. Predominant psychotic, even the scrofulas with the sora, with the psychosis, which you know, the two types, tubercular diathesis having that two types, in which we can see in which syphilis is predominant with sora and its tubercular diathesis having, and another one scrofula where sora is mixed with psychosis. In both these types, seborrheic dermatitis are very much common. In one type, we can see the tubercular type, and another one, the same tubercular type, but in scrofula form. So you can see it in the obese, you can see it in the very lean and thin tubercular diathesis. So it can be seen in the phosphorus, it or can be seen in the calcarea curve. It can be seen in the calcarea curve thin, it can be seen in the calcarea curve obese. So seborrheic dermatitis and like these tinea infections, seborrheic dermatitis, really these are the disease, but whenever as a homeopath we have to treat, these are also clues to know to make the totality of the patient, because these are the clues of the constitution, of the temperament, of the diathesis. Even the tubercular diathesis can be known from these pityriasis versicolor manifestation, from these seborrheic dermatitis. These are the true, apart from the diagnosis, for the diagnosis of the man, diagnosis of the constitution of the man, we should take note of during examining the patient clinically. Another one, that is hives or urticaria. We know urticaria also very common to the rainy season, very common, and especially in case of young adult or in case of child or at the age of 10 to 12, during rainy season, these hives are very common. It is raised. We know these hives are something raised, something from the skin. It is something raised. with the red, itchy, and we can see the triggered by allergens, medications, stress, even medications. We have to know it is not only from allergens, from the external allergens, but it can be also from any medications, from the medications, from modern medicine, any medications, even the stress. As a homeopath, we know Natramur. We can remember Natramur with the appearance of the urticaria with the violent exercise, even that exercise in the form of physical stress, or maybe the environmental factors, even the idiosyncrasy. We know the idiosyncrasy, the very hypersensitivity, or the peculiar corporeal constitution, which otherwise healthy, which is idiosyncrasy. Particular one patient may be idiosyncratic to a particular part, and that may cause this type of hives. So during taking the case, we have to take care of that what are the cause of these urticaria, because only allergens, anyone of modern medicine or any other casual mode of replying that, oh, it is from the allergy. But not only the allergens, the inner economy of the person is also important, because in all men with the allergens, the urticaria never develop. But urticaria may develop due to something related to worms. But if it may be in dynamic level, it may not be due to worms only. It may not be due to direct, where cause and effect relationship can be, we can draw a line with the cause and effect, like this is the worm, so urticaria appear. This is the allergens, urticaria develop. But apart from this, from the dynamic cause, any grief, anything turning point, any emotion, any type of stress, it can also trigger these type of responses. So urticaria type, it is you cannot find it in scabies, but you can find it in any autoimmune type of disorders. You can find it in urticaria, and these wells can appear suddenly and can vary inside the. This is wells, not wells. Contact dermatitis. Sorry, contact dermatitis, the another one. From the contact dermatitis, we have to know that the maintaining cause that should be removed. It is very important that maintaining cause should be removed. So it is also a very much dermatitis condition when the skin comes into contact with the irritant or allergen. It may be from your detergent powders. It may be from your any daily using any materials. So we have to take care of that, whether if the contact you can remove, then the dermatitis may go. So there is no need of medicine. But even just removing the maintaining cause, the disease may remain. In that case, constitutional treatment is required. And also the typical constitution or typical susceptibility also in the typical predominant psoriatic patient that may give rise to contact dermatitis, we have to take care of. These are the some pictures you can see, some pictures, and we will go to the next one. That is melasma. Melasma is very common to females, and especially it's in the lower socioeconomical part of females. You can see this, which is very much related to something pregnancy or hormonal treatments, etc. Taking the pills. So these are very common of the melasma, and usually most of the liver drugs from the shop, whether homeopathy, whether modern medicine, whether Ayurveda, these are taken for these to removing melasma. The very concept, this is a concept going on in the general people, that it is due to something bad liver. So if anything liver tonic like that, or anything medicine of liver like chelidonium, carduas, these even hydrostis, these are very abused for these melasma. But we, as a homeopath, we have to think of that the totality of one patient will decide whether it will be a calculator carb or thuja or chelidonium. Without constitutional or without indications, don't prescribe just to as a routine prescriber to remove melasma, which is not possible. And sun exposure can exacerbate this condition. It is also very important. We know the sunburn. There are so many remedies from Natrum group to Cantharis, etc. There are so many remedies we have which are for the sun aggravation. Gelsemium, Gloline, so many. But on the skin, the Natrum group and Cantharis is very, very well indicated. We know words. There are so many words. Human papilloma virus is one of the important cause. And if it is in the verruca, if it is in the fungal form, just wait for 7 months to 1 year. Usually, it is self-limiting disorders. The fungal words usually disappear within 7 months to 1 year, and by your constitutional treatment, it may disappear early. It may disappear within 2 to 3 months. But we have so many remedies. We have remedies with the indications. We have remedies for the palm, for the extensor surface of the palm, for the reverse part of the palm, the wart in the eye with the causticum, the wart of netramure, wart of dulcamara. There's so many minute differentiation we have warts, and thuja is the most oftenly used, but it is also abused because it is never written anywhere that for all type of warts thuja can be indicated. More than we have 20-30 remedies of warts which can be given, prescribed only on the indications. But as because these type of warts are indications of some type of predominant syphilitic or predominant psychotic miasms. So mostly whenever it is due to predominant psychotic miasm, and thuja may act as partial cure remedy, but thuja is, and it may give result. So it's a wrong concept developed that thuja is the only medicine of, even I have seen so many doctors, so many patients also, they apply thuja in the mother tincture form, but which should be prohibited, because thuja as a mother tincture form should not be used for any type of words. Particularly indications was there in the organon of medicine that in which case, in which fig words and which type of words only external applications can be done. It's never that in any words you will apply thuja mother tincture form. It is very dangerous. It may cause the secondary infection to that. And there are very many type of words. There are so many type of words that in one type that is having the carcinogenic potentiality, they can develop in the form of skin cancer or anything, severe bleeding. So these type of words, if we use without any judicious application, we use anything in the mother tincture form of thuja or anything, it may cause danger. So it is not what with thuja, but it is so common, and thuja become very familiar with the words. Whenever name of words come and the name of homeopathy, thuja come automatically, but not all the words thuja. But the predominant psychotic, I have seen acid nitric to work wonderfully on the words. I have seen causticum, especially thuja on the face, also causticum on the face and eyes, netramure on the hands, dulcamara on the hands. Even so, there are so many medicines. The skin cancer, even the dermatologists take various type of skin cancer. Basal cell carcinoma is the most common form. We have one picture also that basal. So we should take care of that. We should know what that skin cancer. As a homeopathic physician, if we can't diagnose the case, or if the patient should be known that I have been suffering from this type of skin cancer or this type of dermatitis, it may be due to skin cancer. These are the words. You can see the words, the typical, and these you can see the skin cancer, so basal cell cancer. So these are the typical findings. We should be very cautious. It is not very common, but it is not the rarest one. So we have to take care of also this. Even I can say that we have advantage if we can diagnose the patient from the very beginning with his generalities, his appearance, his miasmatic dyscrasias, his past history, family history. Then we can have perception that whether this patient may give birth to the dermatitis or that condition to cancerous stage or not. Because the prognosis of the disease or the advancement of the stage of the disease, whether it will go to very bad part or whether it will be very slow, it will be depending on his miasmatic dyscrasias as well as accessory circumstances, or in the present language, on the epigenetics. So what is going on? What is the environment of the patient right now in the family, in the college, in the professions, in his personal life? Everything matters for the development and as well as for the advancement of the disease. Another one is actinic keratosis. Nothing. It is only involved in its rough scaly patches, which is developed due to sun-exposed areas of the skin, particularly face, ears, and hands, because these are in the temperate climates, these remain open, and these are the more sun-exposed. And keratosis is considered, it is pre-cancerous. That's why it is important. that is actinic keratosis, and can potentially develop into squamous cell carcinoma if left untreated. So it is the pre-cancerous form we should take care of. Another one, that is, it is something different. It is alopecia areata. It is the domain of homeopathy, because alopecia diffusa is not very easy to treat. Alopecia diffusa, we can have a good number of cases of alopecia diffusa, but I am sure that you all will agree that alopecia areata is far more result we get in the alopecia areata, and I think homeopathy is the best choice, should be best choice of treatment in case of alopecia areata. I have seen the abuse of alopecia areata by giving arnica mother tinctures or jaborandi mother tinctures, but you believe me that homeopathy in the potency form like Ustilago in 200 potencies, or constitutional treatment like anti-tubercular drugs in tuberculinum, bacillinum, phosphorus, calcarea, even the drugs like fluoric acid, very high hot patient, the fluoric acid, these are the drugs which can be a very good drug in alopecia areata, and especially having tubercular diathesis or susceptibility to cold, history of pulmonary tuberculosis in the family. These type of patient may develop alopecia areata, which is very much related to, directly you can say that this is fungal infection, or it may come from the beauty parlors or the salons or from the local Berber cyst like type or fungal infection. But actually, whenever your immunity status is low, whenever your susceptibility to disease is high, or you are going through a very bad stage of life, and you are depressed, moderately depressed, so these type of fungal infections may develop, and will give you clue that these are the first manifestation. So by these clues, homeopaths, these are the advantage to homeopath, that we are getting clues that these are the not good thing which is going on in the economy of that patient. We have to take care of. We have to prevent the furthermore. It may be in the very violent form of any disease in any form, but these type of fungal infections from alopecia areata to pityriasis versicolor manifestations to seborrheic dermatitis, these may be our warning signs for a patient for their further step of the disease development. Lichen planus, another one. Right now it is going on very, you can get lichen planus, inflammatory condition affects the skin, hair, nails, and mucous membrane. And I am assuring you, it is my experience, you may agree or may not agree with me, that these lichen planus after the psoriasis, it is the most inveterate, because it takes time. It may cure. Our medicine, our constitutional approach, our holistic approach, but these type of lichen planus are also very inveterate, very obstinate type just after psoriasis. As per my experience, it presents as purple flat-topped bumps that are often itchy. It can also appear as painful sores in the mouth or genital area. The next very important point, the exact cause is unknown, but it may involve an immune system response. So, lichen planus, right now, it can be explained in the light of, again, the low immune response. Your immune system is going low or depressed, and as well as the autoimmune explanation maybe for lichen planus also. Another one, herpes zoster, is a shingles, caused by the varicella zoster virus, which cause chickenpox. The same virus, chickenpox, which can cause the herpes zoster. It's usually unilateral. We have so many remedies. We have Rastrax vesicles. We have cantharis. We have natrum group of drugs. Even the constitutionally, if you think of anything, even for the pain, for the burning pain, you may use spigelia, you may use Apis mellifica. I have never used Apis mellifica, but I have used Rastrax. I have used even the cantharis, and also I have used spigelia for the pain. Even I have used spigelia for the after 3 or 6 months, the burning pain remain in the patient, but the patient is cured, and it is the history of 3 or 6 months prior, but post-herpetic neuralgia is going on, and I got result from spigelia in higher potencies, 201 m. This is a herpes zoster and alopecia areata. You can see the typical presentation. Now, hydradenitis suppurativa, the chronic skin condition which cause painful bumps or abscesses. You can see.
Sir, Excuse me, sir, your slide sharing stopped.
Right now?
Yeah.
Right?
Just now.
Okay. It
Okay
is
then.
okay. So hydradenitis suppurativa. These chronic skin condition cause painful bumps or abscess in areas where skin rubs together, such as the underarms, groin, buttocks. It can lead to scarring and tunnels under the skin if not treated. The cause is linked to inflammation of the hair follicles. So just remember the hair follicles with the acne, with the blackheads, and this one that is something different, which is the chronic. It's a chronic skin condition which cause painful bumps. So you may not diagnose the right one, that what is going on under the arms, what is going on in the buttocks. It is not tinea, but something is there. So where skin rubs together in the areas. So you should know the name. That is the hydradenitis suppurativa. Another one, herpes simplex virus. We know it is with the rustux like the previous one. It is also because we know it is not that homeopathy is specific to any disease. Whenever the vesicles of these herpes can be produced by rustux, can be produced by natrum mute. If the patient is of rustux, if the patient is of natrum mute, then we can think of. So it's a herpes simplex virus. And the last one was in the last slide, that was of herpes singles, but that is of chicken pox virus. Now, another two things, that is morphea. Morphea, it is very rare condition. Actually, it is a form of scleroderma. You know scleroderma better. The scleroderma, it is, we can say that localized scleroderma is the morphea. And in the scleroderma, what is the basic difference between scleroderma and morphea? The morphea, it is the localized, and it is only related to skin. But whereas in scleroderma, it is the systemic manifestation.
Screen is not visible.
Hello?
Slide not visible.
Slide
Yeah.
not visible. Not
No,
visible.
No, sir. I have already told you, no? That time onwards, it's not visible.
Okay. Now?
No, sir.
Okay. 1 minute. What happened?
No, sir. It started sharing. It shows like sharing. Yeah, now it started.
Okay.
Yeah. Now it is started.
Okay.
Erythropoietic. Yeah.
Now we will go to morphea. I was in morphea.
Okay.
So morphea, it is the localized skin condition of the morphea of the scleroderma, and it is the scleroderma in which systemic manifestation is there. But in morphea, it is a localized only related to skin, in which we can see the hardening, the thickening skin. Another one is pemphigus vulgaris. These pemphigus vulgaris never happen without autoimmune pathology. So autoimmune disorders, pemphigus vulgaris, rare autoimmune disorders. It also causes painful blister and sores on the skin. But in our hospital or IPDs, we have seen the cases of pemphigus vulgaris. We have seen it is in the incurable stage, but we give relief by the only constitutional treatment, no external applications. And it occurs when the immune system attacks proteins that hold skin scales together, causing them to separate and form blisters. And if you left untreated, it can be life-threatening. But I have seen pemphigus vulgaris that it can be manageable. It can be manageable, but only with the constitutional treatment. It may be calculate curve. it may be carcinosin, it may be thuja, but very, very high depicting constitutional remedy if you get indications. Because if the patient will not give you indications, then it is the indication that patient is not in curable stage, and pemphigus vulgaris, then symptomatic treatment we have to go for. Then we will come to another one thing, that is erythropoietic protoporphyria. You can see the erythropoietic protoporphyria. This is also very, very, it is a genetic disorder affecting the skin sensitivity to sunlight. It causes painful reactions to ultraviolet exposure, burning, swelling, redness, but without blistering. Because whenever there is photosensitivity disorders we can see the blister. We know the cancer is blister. But this is the without blistering, and over time, individuals of this type of these erythropoietic protoporphyria may develop liver tissues. Very important. Thus, having the genetics, the 3 points are important. The genetic disorders, the ultraviolet exposure, without blister, with the time, it may go to chronic liver disease or liver issues. So it is related to liver issues. The first warning sign is in the skin sensitivity to sunlight. So erythropoietic protoporphyria. Another one, something it may appear that it is something rare, but it is rare. But we have, as a homeopathic physician, as because we have been delivering in the dermatitis, so we have to know the skin, all the manifestations, all the presentations of the different type of diseases in the skin. Ichthyosis vulgaris. These rare genetic disorders, I know that every homeopath have the opportunity to go through few cases of this ichthyosis, with skin become dry, thickened, scaly, resembling fish scales. It usually affects the arms, legs, trunk. The condition often becomes apparent in early childhood, can worsen with age. Moisturizers and exfoliation are common treatment. And I can assure you that this type of ichthyosis, it usually appear in a particular time and disappear in a particular time. So like we have one drug like allosocotridum that each appears every winter like that. So these ichthyosis also can appear in a particular time of the season, and all the other seasons it may be very normal. Even you may think that your medicine worked, but you have to know that whether your medicine worked or the it is the spontaneous disappearance of these conditions of these fish scales and the scaly appearance thickened. It may persist for the throughout the year, but in most of the cases or few cases, it has been seen that within for 1 to 3 months it may appear. It may be in the winter season, it may not be in the summer season or rainy season. So this is our ichthyosis vulgaris, and I can remember one very good case in one good book, which is the ichthyosis is totally more than 15 years treated with very good with the thyroidinum in 30 potency to 200 potency only within that treatment and in between that placebos. So thyroidinum proved to be very efficacious in type of ichthyosis, but especially there are 3 or 4 indications of thyroxine like body swelling, etc. The clinical findings, clinical symptoms of the thyroidinum. It is not that the specific thyroidinum, but thyroidinum, one case with the evidence of ichthyosis, it worked. That's why I mentioned here. Another one, the Hailey-Hailey disease, that is a chronic benign familial pemphigus. It is a rare genetic disorders which cause recurrent blister and erosion in skin folds, underarms, groin. The skin becomes fragile, leading to painful sores. That it is a very rare one, inherited autosomal dominant pattern, often worsened with heat and friction. We can't do nothing. It is an incurable disease, but we should not say patient that with the medicine it may cure it. You can give the constitutional treatment, but whether it will be cured or not, only time will say. But medicine books say it is mostly incurable disease. From all over the treatment, it can be only time to time managed, and symptomatic treatment must be there. Dermatomyositis. We should know dermatomyositis because right now, dermatomyositis is going on. It is steadily increasing, dermatomyositis. And these dermatomyositis can be diagnosed only confirmed diagnosis by muscle biopsy, by skin biopsy, but muscle biopsy is very important one. Why it is important? Because dermatomyositis has got the potentiality to develop cancer. It is a typical Gautrens-like papules rash, typical rash with the pain, arthritis, and we can be confused with the arthritic pains with Systemic lupus erythematosus, we can be confused with typical type of rheumatoid arthritis, seronegative rheumatoid arthritis with little bit of fever. So there is differential diagnosis of low-grade fever of different type of arthritis and arthralgia, even with the rheumatic arthritis. But typical only muscle biopsy can diagnose whether this is dermatomyositis, and we have to know this because it has the potentiality to develop cancer, and it is very similar in samples in the presentation in systemic lupus erythematosus. So we have to know this as an autoimmune skin disorders, and typical appearance of the FUS is the reddish purple rash, often on the face, eyelids, chest, and joints, that Gordon's papules. These are the very characteristic of dermatomyositis. I will say the second one, the next one, that is pityriasis. Pityriasis rubra pilaris. This is very important one in relation to homeopathy. This is rare skin condition, cause chronic inflammation and scaling of the skin. Typically presents with reddish orange scaly, reddish orange scaly patches. You can see the orange scaly patches and thickened skin on the palms and soles. Exact cause unknown, but occur in both children and adults and may last for years. And what are the presentations here? These presentations very much resemble to anagalis. I am not the anagalis is very, very effective in palmar eczema or etc. like that. But the presentation like that, anagalis can produce this type of symptom, but it is a very rare condition. Next, the role of dermatology in overall health and well-being. We have to know that we all know that skin, these are the body's largest organ, skin, and playing a critical role in protecting against pathogens, regulating temperature. So dermatology not only improves skin aesthetics, but also addresses more serious issues such as cancer prevention and autoimmune diseases. Healthy skin reflects overall well-being, and addressing skin conditions can boost both physical health and psychological well-being. Actually, what I want to establish that through the skin diseases, our body, it is a part of vis medicatrix naturae. It is the part of our inner economy. It is the part attempt from our inner economy, from our vital force, from our life principle, or whatever in the name you say, that from the very big disease or very grave disease, these skin diseases can protect us to go to the next stage of that violent diseases. It always not be cancer. It always not be a very malignant type of liver disease or kidney disease or heart disease. But whatever it is in the skin, whenever it is in the skin, it is in the form to protect you. So skin diseases, it is like fever, coming fever. The fever is a protective mechanism of our body to get rid of the bacteria, all the toxoids. Like that, skin diseases, these are the warnings. These are the true indications to a homeopathic clinicians to know that the patient is not in a good state. This is the right time. And if we go through the totality of symptoms, make the totality, with the individualistic approach, if we can cure, then the very grave type of chronic disease may not appear with the patient. So with this homeopathy, we know homeopathy having all the great things like holistic approach, like individualistic approach, from organon of medicine from 1810, 19, 24, 29, 33, 1921, 6th edition, from centesimal scale to 50 millisimal scale, and all our genus epidemicus concept, with even it coexists with conventional medicine. So recognized by the World Health Organization, certain chronic condition, and it is faced several criticism regarding scientific evidence of efficacy. But whenever one homeopath who know homeopathy, who know organon of medicine, who know homeopathic philosophy, he only can understand, can perceive, rather can feel, can perceive what is the importance of skin disease. It is the skin disease through which it is the organon of medicine from which we can understand the sora. When sora was in the form of violent form of leprosy, now the violent form of leprosy or erysipelas now came down to little bit of each, like scabies, just to invade, just to infect all the human being. Because as a very severe form, malignant form of leprosy, it cannot infect all the human being. But always bacteria, virus, or whatever the pathogens, they want to invade, they want to infiltrate among the all human community. And so it is in the minutest forms, they are right now not in the primary phase. They are right now may not be in the secondary phase. They are in the very next stage. And right now, it is not in the primary form of SORA, but it is in the form of minutest scabies-like form, but it has already infected all of us. So we all become predominantly SORA, the mother of all. We are all polluted by this SORA. And within the superimpose of psychosis and syphilis, even in today's scenario, we are all multimasmatic. We have the personality or the characteristic with the predominant one in the effect of the accessory circumstances. All the accessory circumstances, environmental factors, miasmatic dysplasias will decide what type of disease will develop, and if any disease develop, then what stage that will go on the basis of the person's individuality. So I will mention some recent studies. If we go through some recent studies in acne, it was found that some evidence-based studies on the basis of PubMed. I have the references. It is found phosphorus was found effect. I am not telling that phosphorus is the medicine of acne, but in the paper published evidence-based and the research, few papers published in which phosphorus worked very well in acne. In psoriasis, arsenicum album and sulfur, it was worked wonderfully, but always you have to that without the totality, without the holistic approach, psoriasis cannot be cured. Even psoriasis may not be cured throughout the life, but the spontaneous remission and appearance is the characteristic of autoimmune psoriasis. But if by our constitutional treatment we can stop that, we can break the chain, then the psoriasis, and if we can the patient may be in the stage of hilarity, stage of mirth, the patient, the depressive effect is not there. Any triggering factors of autoimmune disorders appearance, if can be stopped by our good case taking, good counseling, good follow-ups, then with the constitutional approach, the psoriasis may be cured. Psoriasis may be managed. The eczema 2022 studies with the atopic dermatitis, antimonium, trudum, and graphitis, it was very good. In words, Thuja found very effective. We all know Thuja is very effective one, but not only Thuja. And in psoriasis, you see, I was just talking about psoriasis with the mental condition, the emotional condition, and you see the carcinosin and Ignatia amara. This Ignatia amara, I can remember at NIH, one study was there which proved that Ignatia amara was the very good palliative approach for cancer cases, for established CA cases. The same Ignatia amara proved to be a very good drug for the psoriasis-like invertebrate skin disease, the carcinosin. This is one of the study of 2020. If we go through the meta-analysis, we can see in the meta-analysis that recent meta-analysis systematically reviewed randomized placebo-controlled trial, that is RCT, different conditions, including dermatological issues, some high-quality trials, and systematic review. Also, it is a challenging one we have, but we have to go through this. Some uncommon remedies you can see. Most of is well known to you, but I must say one, that is Dolichos prudenus, intense itching without visible skin symptoms. Particularly is, don't think it is very uncommon. These Dolichos is very good drug for chronic liver disease. So whenever there is obstructive jaundice occur, and due to obstructive jaundice, itching appears. So Dolichos may be the drug, but really that itching is related to high bilirubin level of obstructive jaundice. So Dolichos is a drug of chronic liver disease. Like Kandurango is a drug of CA. And like hydrocortyl asiatica, if you go through the hydrocortyl asiatica from the very good source books, it is effective in treating thickened scaly skin. Means it is of morphia. It is the scleroderma. It is because hydrocortyl asiatica is very much related to thick skin. It is not only for elephantiasis, not only for filariasis. Hydrocortyl is very good drug for fever also. This filariatic fever or hydrocortyl asiatica related to any type of scaly skin and thickened skin, but constitutional symptoms should be there. Caliers, very good drug for any invertebrate skin diseases. The creosotum also for skin cancer. And I must mention one drug, that is oleander. Oleander, never give oleander without tubercular background. And the intestinal tuberculosis like chronic diarrhea is one of the most indications associated symptom with the skin symptom. Radium bromatum related to radiation burns. Staphysagria is one thing, one point is not mentioned here, but I must mention that one point infection is there, anything dermatitis, whenever that part or that any discharge, that discharge from hand to mouth, whenever hand to feet or feet to hand, whenever it can go like metastatic, like it is mechanical metastatic like that. The staphysaglia is very important. That patient complained that I have the skin dermatitis on the foot, but now suddenly I appeared in the hand. It is very
Dr.
not
Rajat?
related to staphysaglia. Yeah,
Dr.
I
Rajat,
will.
sir?
Yeah.
We
I am
have
in the
only
last.
3
I am in the
minutes.
last part. This is the Artica urens and sepia. It's very related to discoloration, pigmentation, dry eczema. We can differentiate with tellurium and sepia, and we must not forget our rustox, Barbaris aquifolium. Even this Barbaris aquifolium is very effective of eczematous condition and atopic dermatitis also. It is not only for acne and dark pigmentation. And Anagalis, never forget Anagalis for palmar eczema. So we have benefits with homeopathic treatment. We have challenges of homeopathic treatment. We have so many advantages with homeopathic treatment, non-invasive treatment, minimal side effect, holistic approach. And these are the real clues to identify the man, whether he is in danger, whether any danger, we can predict, we can assume the patient having grave disease or not. So with our holistic approaches, the challenges only, that is the lack of widespread acceptance. And scientific evidence, all are talking like that, but we have lots of scientific evidence and evidence-based medicine in the PubMed, published journals also, with the repeated cases, case series studies, case studies. These are our real strength. We have something lacuna, we have something weakness in the concept, in the acceptance, but we have to make our patients homeopathic orientation. It is the most important part, that homeopathic orientation. We have to go through our policymakers, our bureaucrats, our patients, even the students from the very first year onwards. And these are our future challenges with the research development, with the postgraduate students and we may have a very good future, very bright future of the homeopathic students when we will see that the homeopaths, they are practicing homeopathy only on the skin diseases, and they will be called as homeopathic skin specialists because they have to concentrate only on skin diseases like other specialties in modern medicine. So we are in search of that days when that the homeopathic specialty in the true sense in the skin diseases will be seen in the society, and the social acceptance of homeopathic in the specialty subject can be observed with the good result. Thank you.
Thank you so much, sir. Actually, normally we will have a interactive session after the class, but unfortunately we participants have no time to ask anything to Dr. Rajat Chaupathy. Now we have to move to the Malayalam session. Thank you so much on behalf of IFPH. I'm thanking you. It was a great session, and when it's I think we were running huge knowledge. Within 1 hour we got much. Thank you so much, and come again. We will have interactive session. I think all the participants need to ask you something. If you have any question, means you can send to the chat box. We will answer your.
Definite.
Thank you, sir. Thank you so much. And really, we are happy to get you as a faculty today. Thank you so much on behalf of IFPH. Now we are moving to Malayalam session. I am inviting Dr. Danesh have to say something. Okay, Dr. Danesh, please.
No, it was really a great session, sir. Thank you very much, sir.
Thank you.
We can have a second part later, sir.
Okay.
Yeah, I'm inviting Dr. Manoj for moderating Malayalam session. Dr. Manoj, you're welcome, please.
Thank you, Dr. Ajini. Thank you all the